Hello, everyone. Welcome to CEIH's Improvement Showcase. Really excited to join you in 2022. This is the first one back for 2022. So hope you're all well and thank you for joining us during this busy time. I'd like to just start by acknowledging that the land we meet on today is the traditional lands. For me, working at home today, I'm on the traditional lands of the Kaurna people, and I understand that many of you would be on different spiritual land for the Kaurna people and for the Aboriginal people. So just acknowledging that we respect their spiritual relationship with country, and we acknowledge the Kaurna people or the lands that you're on as the custodians of the Adelaide region, and that their cultural and heritage beliefs are as important to the living Kaurna people today. Always a hard acknowledgement when we're all on different lands, but lovely to connect virtually. So for those of you who aren't familiar with this Commission on Excellence and Innovation in Health, we are the lead agency for innovation in healthcare in South Australia, and we are about bringing consumers, clinicians and the community together to collaborate for better healthcare for South Australians. To be able to do this, we need to create and imagine new ideas and new ways of doing healthcare. And we need to acknowledge that better isn't always excellent, but we need to commit to measuring what we're doing so that we can make changes and make them different. So what if the big idea was connecting the small ideas? That is the essence of why we host these sessions, to connect us all together. It's about South Australia and how we can connect people across the state. So really excited to have you all here today. So just a little bit of housekeeping. This session is being recorded and we're excited that you can promote it and share it with your colleagues. It's available online shortly after the session once we get it up on our website so that people can always watch the session. Our Q&A session at the end of Kathy's presentation today won't be recorded, and that makes it easy for asking questions and sharing conversation. So we like to keep these sessions simple, and we really want to hear from you. Have you got a story to tell like Kathy is going to talk to us today? Have you succeeded in solving a problem or learned something while trying? Or do you have a specific theme that you would like the Commission on Excellence and Innovation to explore during one of these innovation showcases? So we look forward to hearing from you, and the contact email address for you to share your ideas and thoughts is there. So today we have a different series each time. We're up to series 8 on the improvement showcases, which is fantastic. And I'm really excited that we're kicking off with Aging Well this year and for this series. We're going to start off with Kathy. I won't introduce her quite yet, but the other two sessions we have in this series, we have Jeanette Walters and Monica Novick joining us from Wellbeing SA, talking about connected, coordinated and collaborative care. And we're really excited to have Mandy Ross from the ECH Care Hotel talking about their experiences about innovating for ageing well and in older age groups. So today I'd really like to welcome Kathy Williams. Kathy is the Manager of Ageing Policies and Projects in the Office for Ageing Well from the Department of Health and Wellbeing. I'm not going to steal her thunder, so I'm going to let Kathy talk to us about realising South Australia's innovative vision for ageing well.
Thanks, Nadia, and I'm delighted to be here today to talk about ageing well and particularly some of the innovative work that our office has been doing in partnership with a whole range of different organisations and communities. I'd like to acknowledge that the land we meet on today is the land of the Kaurna people. Well, the land that I am on today is the land of the Kaurna people, and I pay my respects to elders past, present and emerging. And as Nadia said, I'm the manager of the Ageing Policy and Projects team within Office for Ageing Well. And I think we all have a vested interest in ageing, as we're ageing from the time we are born. And now I'd like to talk to you a little bit about the role of Office for Ageing Well, and then to talk about how we develop the South Australia's plan for ageing well and some of the innovative projects that we have underway at the moment. So for those of you who don't know, Office for Ageing Well sits in the Department for Health and Wellbeing, and we have a number of business units. We manage the Seniors Card program on behalf the seniors card program. We have about 410,000 seniors card members in South Australia. It's a big group of people. They're all over 60 and working less than 20 hours a week. So you're talking about big numbers here. We also have the Retirement Villages unit, and we manage the Retirement Villages legislation and help resolve disputes between residents and providers, and it keeps the team very busy. We have the Aged Care Strategy Unit, and they manage the Aged Care Assessment Program on behalf of the Commonwealth Government, and they also are undertaking a few strategic projects focusing on aged care. My team is responsible for leading the development and implementation of South Australia's Plan for Ageing Well, and as I said before, I'll talk about that in a little bit more detail. We have an Ageing Community Grants Program, and you can find more information about that grants program on our website. And it really creates opportunities for community organisations and local governments to provide opportunities for older people to be involved in their communities. You may have heard about the Adult Safeguarding Unit. That's also in our office, and we we provide information and support for people that might be concerned about abuse of older adults or adults living with a disability. And the unit also takes reports and responds to reports about concerns. And it's been going for about 2 years. At the end of this year, it opens up to take reports and provide information for any adult who might be experiencing abuse or mistreatment. And the unit is getting around about 1,500 calls a year. And for the past 2 years, it's been keeping my director very busy, but we've been managing and leading the state government response for COVID-19 in aged care. And I think what underpins our philosophy is a co-design and partnership approach. Everything we do, we involve and we consult and we engage with older people, and we work across government, we work with non-government organisations, universities and community organisations. We recognise that older people, and I'm talking about people that are 50 plus, so some of us here on the showcase, I'm sure that it relates to all of us. They're the experts in their own lives, and we ensure that we have mechanisms that we engage and we co-design, and they're involved and inform all of our work. So who are we talking about? We have 633,000 South Australians that are over 50. About 25% are between 50 and 70, and 12% are over the age of 70. And there isn't a one-size-fits-all approach. We do happen to have a society in which we tend to stereotype older people. And I think we forget, particularly in the health system, that older people are diverse. They have diverse experiences, aspirations, needs, wants, identities, roles. I think the last census that I heard in 2016, I think, there was still one person over 100 in the workforce. So, you know, I think they say 80 is the new 60. And so we have a very diverse older population with 5 generations and all different, yet we tend to kind of stereotype and we think a one size fits all works. And most older South Australians live at home independently in their communities. About 95% of older people do. 5% live in residential aged care, and 1 in 4 people that are over 85 live in care and accommodation. And I think older people are more likely to experiencing ageism, and including being helped without being asked. 1 in 3 older workers, and I'm talking about particularly women in their 40s and 50s, experiencing age discrimination. 58% of South Australians aged 50 and above carrying out the recommended amount of exercise per week, but that declines as we get older. And Australians 55 plus contribute almost $75 billion each year in unpaid caring and voluntary work. So I wanted to paint a picture, because I think one of the things that we can tend to do is stereotype all older people as being the same. And I wanted to kind of just challenge that and I guess think about the unconscious bias that we might have ourselves. And I think for us to be able to support people to age well, you can't just think about that when you're 65. It's a life course approach. And what happens to us as we go through life, thinking about the determinants for health and well-being, employment, education, community, transport, all of those things, I guess, make a difference to whether you have experiences of good aging well or whether you face more barriers. And to really understand what matters most to people to age well and what gets in the way, in 2018 and 19, we undertook statewide conversations with older South Australians, and particularly wanted to hear from people that are hard to reach. And an innovation that came out through that project was that we trained up through the Australian Centre of Social Innovation. We trained up older people to go out and to talk to their peers using a standard framework. So everyone was kind of asking the same questions, but being more comfortable talking to their peers rather than, you know, someone from the government. And what people told us was really interesting, and I'll talk about that a little bit later. And then we wanted to check in with stakeholders and organisations and non-government organisations, universities, and including older people to see what whether that resonated with them. And out of those conversations, the SA's plan for ageing well was developed, and older people had a direct input into the strategic priorities, enablers and supporting conditions. And I haven't turned my slides over, so that's a bit lax of me. So I'm going to just go through and get up our plan on a page, which you'll see is, I guess, a tree. We wanted to demonstrate that it's an ecosystem, and without the supporting conditions, it's really hard to deliver on the strategic priorities. But people were really clear, and what they told us that homes and communities are important, and that people want to stay local and they wanted to stay and age in their local communities, but they needed better options to be able to do that. We know that loneliness is a bigger predictor of early sickness and death, and smoking and drinking. And so people were really clear that having meaning and purpose and meaningful connections with others is a critical factor to living and aging well. Being able to navigate critical changes as we age is equally as important, and having access to things and services and supports and information when and as you need it is pretty important, and having opportunities to build that resilience and to be able to bounce back from negative life events. And what we're trying to do with the plan, and I guess the plan is not just for Office for Ageing Well, it's a plan for South Australia, and we wanted to inspire and we wanted to create a framework that people can help deliver on the vision. And I'll just take a moment to read the vision because I think that it's important. The vision for ageing well in South Australia is that South Australia is a healthy, connected, equitable and sustainable community which takes a whole of life approach and fosters many years of living well and supports us to die with dignity and in line with our wishes. And, you know, there's no mention of older people because, as I said before, it's a life course approach. And it is a vision. So we are, you know, hoping to, over time, help realise that vision. The statewide conversations that we held during the consultation on the plan, and also the recently and very public Royal Commission into Aged Care, really highlight that ageism is pervasive within our society and it's often unconscious. And the negative narratives and imagery seem to be embedded and contribute to ageist attitudes and create barriers to living and ageing well. And it also affects the way government activities, you know, the way we deliver our services, the things that we do, and the way we care or talk about people. And the plan's enabling factors, we really wanted to highlight tackling ageism as a basis for actually creating good lives for us as we get older. Understanding diversity, like I said, is really important. A one-size-fits-all approach doesn't work. And we also have to make sure that things are accessible, whatever they are, whether it's, one of my big things is menus. You go to a cafe, you can't read the menu because the font's too small, or you can't find a service because everything's online. So accessibility is really important to support people to live good lives. And one of the ways that we're trying to raise awareness about ageism, because ageism seems to be that ism that isn't necessarily well understood, but it could affect us all compared to sexism or racism or ableism. So we wanted to kind of shine a light on that. And what we did was we sponsored a category for tackling ageism in the SA Community Achievement Awards to recognise and encourage individuals and community groups and organisations to take action to better promote the value of older people. We received 22 nominations last year, and the award was won by South Australian researcher and physiotherapist Untitled Jasper in recognition of his contribution to understanding the pervasive nature of ageism, with his research focusing on preventing frailty, immobility, and sedentary lifestyle in older people, but particularly people in hospital. He highlights that in hospital, people can sit and lie around for up to 23 hours a day. And through his work at the Queen Elizabeth Hospital, he educated and collaborated with staff and patients, including doctors, nurses, social workers, and older people, to find innovative ways to promote physical activity among people while they're in hospital. The impact of his work highlights that when teams and patients work together, subtle ageism can be exposed, tackled, and result in improved health and wellbeing outcomes, as well as systemic changes. Challenging ageism within healthcare, but also within the media, communications, organisations, and the wider community, to achieve a positive view and a positive narrative of older people, we're developing a new age-positive communications toolkit. We often see people portrayed as frail, withdrawn, and in stereotypical, unrealistic situations. And it doesn't represent diversity or portray the value of our older people. So our age-positive communications toolkit, we're developing that in partnership and co-design with older people, with communications teams. And we're really trying to raise awareness and I guess give people some tools and ways to avoid stereotype imagery and the negative narrative. And we want to roll that out across government, community, business, communications teams, local government later on this year. So watch this space. Another project that we have also undertaken over the last 2 years is our age-friendly services project. And we really want to seek to tackle ageism by improving the customer experiences of older people through government or over time, business and the like. And the way we went about developing that is we co-designed the guidelines and the website with older people and also state government services, the frontline staff. And there's a dedicated website and we have resources and tools, and it really is taking a quality improvement approach to ensuring that services are age-friendly. And last year, we piloted an age-friendly services week across 7 government organisations and to seek feedback from older people about their experiences and then to identify areas for improvement. And I'm pleased to say that the South Australian Government Chief Executive Council has, we have support of them to roll the week out more broadly across government later this year. And we will be embarking on that piece of work. And we're looking for customer service teams to participate in some free education and training, and then also to help, be part of the annual Age-Friendly Services Week, which will be held in October this year and aligned with International Day of the Older Person. So again, if you're interested in participating, please contact me after the showcase and happy to have a conversation with you. And I think I said, and I hope I'm demonstrating that innovation and collaboration is at the heart of everything we do. One of our strategic projects called the Rainbow Horizons project is being delivered in partnership with CODA SA and through its Rainbow Hub. And the essence of that project is to develop a compassionate communities model for LGBTI people around end of life, around death and dying, and around planning. And we want to trial that and then hopefully roll that out more broader across different communities. And the aim of that is to have greater support and improved services where people feel safe, valued, listened to and connected. And like I said before, basically a better quality of life, care and dying experience. Another example of an innovative project that we have underway with cities of Ongaparinga Council, Marion Council, Holdfast Bay Council and City of Mitcham is the Advanced Care Directives project. And that project is working with community members and other stakeholders to develop a sustainable model and locally driven peer education model to help increase the completion of advanced care directives. The project is designed to engage stakeholders through a steering group and surveys with older people as co-producers of change. And by using this approach, not only do people, feel more confident and able to fill out their advanced care directive, but it also enables people that are involved, the peer educators or even community members, to develop new skills and gain knowledge and help them and be empowered to safeguard their future rights and wishes. And we're expanding or leveraging off that model to other council areas over the next few years. A really heartwarming project that I want to talk about is the Childcare and Aged Care project. And we partnered with the ACH group, UniSA, TAFE, UniSA and TAFE to co-design this intergenerational, connection model. And for those of you who have seen the old people's homes for 4-year-olds, the idea was really came out of that. We were inspired by that idea and wanted to make that happen in South Australia. It is the first of its kind. And the project brought together kindy age kids, so 4-year-olds with aged care residents, to create opportunities for meaningful connections. And the activities were facilitated by OT students from UniSA. The project was also evaluated by UniSA, and I wanted to just talk about some of the outcomes from that project. Initially, it was designed to be a face-to-face interaction, but for many of us, as we know, COVID kind of got in the way. And I think that helped to then motivate for us to develop an online or a virtual model. So we have a face-to-face model, but we also have a virtual model. And that came with some challenges, but also I think some benefits. So
just check you didn't have slides you wanted to show.
Oh, sorry. Yes, I keep forgetting about my slides. Not very good, am I? Yep. So I thank you for reminding me, Nadia. I have to. My team has given me slide prompts, but I haven't been looking at them, so I apologise for that. You just had me to look at. To address the technological barriers to meaningful connections, activities were designed with input from residents, the children, staff, and OT students. And in one session, children decorated pots, and these were then delivered to the residents to pop plants in them at the next session. And the kids and their grandfriends, as they call them, really enjoyed it. Participants reported that even though connection was somewhat limited by the virtual nature of activities, it was still real and it had positive effects on feelings of loneliness amongst the residents. The project also increased technology skills in a fun and engaging way and brought along valuable learnings on how meaningful connections can still happen in a changing world. It also provided a great opportunity for innovation and collaboration between generations who traditionally are thought to have not much in common. The Grand Friends program is still going, and so are the newly found friendships. And there are many things that affect our ability to age well. And in recent years, older South Australians in particular have experienced wide-scale environmental challenges, particularly in regional areas, through bushfires, through COVID-19, and other social and economic implications. And I think, we tend to hear that people living in regional communities, particularly those who might live on farms or remotely, face some greater barriers to ageing well. And we wanted to kind of understand how regional communities navigate changes, not only as individuals, but also as communities. And we partnered with Wellbeing SA and the plugin at COTA to deliver the Navigating Change for Growth project. The project will run over 2 years, and it focuses on, like I said before, older people in regional South Australia. And we wanted to understand the strategies used by individuals and communities to navigate significant events such as bushfires, economic downturn, and technological change. The project will identify drivers and barriers to successfully responding to change, as I said before, at an individual and community level. It will provide insights into how to support people and communities to navigate changes in a positive way, and we're hoping to be able to spread the findings to other communities. The design of the project included a number of stages. There was a literature review stage, and it was identified that although there are research that highlights some strategies, a South Australian perspective is required. We're in the middle of stage 2 at the moment, and that includes community surveys, focus groups, phone interviews in 5 regional and 2 metro areas. And then stage 3, it will be the collation of results and a final report, including recommendations. I just wanted to talk about some of the findings. So we've had about 530 people complete the survey at stage 2. 60% were volunteers, 70% were community members, and 64% were retired. Obviously, they might have been a combination of those, given that it doesn't add up to 100. Key findings highlight that increased negative outcomes for those living in regional areas, including lower wellbeing, less access to services, and generally, most of these due to economic impacts. Other findings were that protective factors that support wellbeing include both personal strategies and community level supports, such as staying informed, volunteering, or just feeling valued in the community, and having supports in place to be able to use new technology to connect with others. The project will further explore vulnerabilities and coping mechanisms used across the different cohorts when navigating changes. And it will dive deeper into social identity, creating space for meaningful connections, building resilience, and identifying further barriers and roles of intersectionality for individuals and communities experiencing change. So how do we know we are implementing things that work or produce positive outcomes and support people to age well? It's a very challenging thing to be able to evaluate and measure the impact of work that happens not only from our office, but across the broader state. And we, like I said, partner with a whole range of different organisations. So trying to work out a framework to measure success where activities are happening at all different types of levels and with different types of people is challenging. But we wanted to take it on. And so what we decided to do was, again, use a co-design approach to look at our plan and identify what success looks like and how we might measure that. We engaged URPS to develop the Aging Well Measuring Success Framework. And like I said before, it's quite challenging, and it's never been done before in terms of the Office for Aging Well's work. The framework we just finalised the framework, and it contains tools to understand impact. And the idea is that it builds transparency, accountability, and it helps develop the narrative and evidence base that supports what and how we do things as a state. It aims to identify good practice, share learnings, and inform future practice. and it employs a theory of change approach. And in itself, it can be a tool for affecting change. We are hoping that the framework will support advocacy by our office. We work, like I said before, with a lot of different government agencies and non-government agencies, and often, you know, we've had conversations with Transport who don't think they do anything for older people. So, you know, I think we have a lot of work to do, and we'll probably be in a job for a while, but it is quite fulfilling. And to develop the framework, we used the co-design process. We had 2 face-to-face workshops and 1 online co-design workshop. And over 100 people participated in that from different types of organisations, older people, and helped us really understand what success might look like, and then help us to work out what types of measures might be useful. And we focused on the plan. Sorry? Next slide. Oh, yep, sorry. Good point. I should have had you navigating it, Nadia. And I think, you know, we wanted to focus on the plan's vision, strategic priorities, and it was helpful to have people describe what success might look like. So you can see a little bit of a snapshot there on the screen, and we're in the process of finalising the document itself, and we'll be sending that out in the next few weeks. And I think, you know, to understand impact, each of the indicators or measures of success can be measured in a variety of ways. And the framework contains some suggested methods, data sources and tools. So we've got a community perception survey, template questions, we have key informant interview questions, data collection sources, audit tools, grant or funding recipient self-assessment survey, and a question bank for focus groups. And URPS have just completed a benchmarking exercise using the framework, and this will be followed by a midpoint review of the plan in 2023, and then a final evaluation of the plan in 2025. And it also gives us a chance to be able to refine the measures and the indicators, and I guess see if it's working, because it is a first for us. And the framework can be used by anybody who wants to see how they're doing in the ageing well space. So once it's out, I encourage people to familiarise themselves with that. So I think that's about all from me. I hope you're able to gain some insights into not only our work, but also what older people continue to tell us is important to them. And I think to realise the vision of South Australia's plan isn't just up to government, it's up to anybody who works with older people, who has an interaction with older people, to help you know, create those changes to realise our vision. So I'm happy to answer any questions.
Much, Kathy. If you stop sharing screens,
I can.
Great to see each other's faces. Thank you very much to Kathy for her time and for presenting such a great broad brush overview of what is happening in both the policy and the implementation arena from the Office for Ageing Well. So thank you.